This firefighter was showing no signs of illness on his last work shift, which was on Friday, March the 20th, but began displaying symptoms at home over the weekend. So after reporting symptoms to health providers by phone on Monday, this firefighter, who lives outside of Jefferson County, was tested due to his job as a first responder. Monday's test results came back positive, and he is now self-isolating at home. So our Metro Public Health and Wellness team is working with the firefighters, home county health agency, and Louisville fire officials to determine next steps. I can say that since the outset of the COVID-19 outbreak, the fire department has instituted several protocols to keep firefighters and the public safe. Each firefighter has his or her vitals checked 3 times during a 24-hour shift, and any personnel showing a fever of more than 100 degrees or other symptoms is sent home for further evaluation. I want to say that our firefighters obviously are putting their lives on the line every day, and we're really grateful to them and to all of our first responders whose lives are being upended both at work and at home because of the COVID-19 crisis. So we wish this firefighter well, as well as anybody that's tested positive for COVID-19. So that's all the information I have to share at this point. Tomorrow we'll talk about the number of firefighters that are going to be quarantined as a result of being in contact with this confirmed case. So this firefighter, we're hopeful, will have a great recovery. As we know, most people have a great recovery. Over 80% of the cases are mild, 14% are severe, and 5% of them are critical. Folks over 60 and those with chronic health conditions are most vulnerable. And I cannot say this enough. We have to do everything we can to keep COVID-19 from reaching our most vulnerable populations for their sake. And because if we see thousands of more illnesses, it could overwhelm our hospitals. So people would have to be, or the care to people would have to be rationed like we're seeing in other places around the world. We do not want that to happen here. Our incident management team, we also call them the IMT, is monitoring hospital bed space and working to coordinate our efforts with our medical providers here in the community. Right now, we're not seeing the challenges that our other communities are facing with hospital systems being overwhelmed, but we know things are changing rapidly, and we are not on the curve right now in terms of the spike coming to our community just that. So I don't want anybody to think that we're ahead of this thing. And the next few weeks are absolutely critical. We have to slow and do everything we can to mitigate the spread of the virus, and we have the power to do that. I would say most people here in Jefferson County are practicing social distancing, and they're making the changes and sacrifices that this moment demand. So many plans have been canceled. Parties, weddings postponed, baby showers, reunions. And I know that's hard, and I know that's disappointing. I know most everybody is adjusting to this new reality, so I appreciate that. But it's also what this moment demands of us. Not everybody is stepping up, though, like the way they need to step up. So I want to switch to now talking about the expansion of an emergency order that I just signed. So to continue taking necessary steps to save lives in our city, an hour ago, I signed an executive order continuing and expanding the state of emergency I declared on March 13th. That order had an expiration date of April the 12th. This order extends the state of emergency through May the 10th. Again, this new order extends the state of emergency in Louisville Metro until May the 10th, and we will evaluate that as we get closer to that date and will not hesitate to extend it if that's what it's going to take to save more lives in our community. This order extension today incorporates and extends all of the provisions contained in the earlier order. And beyond that, this order states that all Metro hosted events are canceled and postponed through May the 10th, 2020. Also effective today at 5 p.m. through May 10th, 2020. At 8 a.m., I have ordered the following actions to contain the spread of the virus and safeguard our community. First, all Metro Park playgrounds, soccer fields, and basketball courts will be closed to the public. All portable toilets in the parks will be closed and removed. The campground at Jefferson Memorial Forest will be closed. Parks and Recreation will continue to clean all open, permanent restrooms at this time and will pick up garbage and mow grass. All dog parks where dogs are allowed to roam free without a leash are closed, and dogs on leashes are still permitted where allowed. Group activities such as soccer games, basketball, tennis, pickleball, or any activity that promotes congregation in our parks are strongly discouraged because of the need to practice social distancing from others, and also because, remember, the virus spreads on surfaces. So even if you could practice social distancing and play basketball, if somebody has the virus, it gets on the basketball, you touch it, you get the virus, you become a carrier. All golf courses will remain open, but must abide by the clubhouse coronavirus protocol that's posted at every course. And the clubhouses will remain open except for the retail area as long as patrons and employees practice social distancing. And there are a few other items specific to our colleagues, employees, our team here at Metro Government. I'm directing all Metro agencies to review their authorities regarding the suspension of interest and penalties during this pandemic in collaboration with the Jefferson County Attorney's Office. Also effective today, Louisville Metro agencies are empowered to request, or as needed, require employees to work in other areas of their agencies or in other Louisville Metro agencies that may be subject to the scope and/or recognition of the ratified collective bargaining agreements while retaining their current rates of pay, benefits, and other rights according to their current collective bargaining agreement and/or Louisville Metro policies. I want to just stop for a minute and say I really appreciate our Metro employees. They've got tremendous hearts. They're in public service for a reason, and they have more than risen to the occasion. So I want to say thank you to them. Thank you for this increased flexibility you now have to do more important work in the community. We have obviously communicated with our unions regarding the terms of their executive order. I want to thank our unions. They have been good partners in times of need, this time of need, and they are on this as well. So good job to everybody. I know this is a lot of information at once. We'll be releasing the text of the full emergency order expansion, and I'll take some questions as well at the end of this press conference. For those that are bummed out about the parks and such, I'm bummed out too. I didn't want to take all these steps, particularly the closure of publicly accessible areas in our parks, and was hoping they would not be necessary. But too many people have shown that they have yet to grasp the serious nature of this threat, and we're gathering in our parks in groups and ignoring social distance guidelines. So nobody is exempted from these restrictions that we've put in place. And so people felt like they were, so this was the next step we had to take. I'm sorry about that. That's why these steps were taken, and everybody, please comply. Okay, next, vendor licenses. I talked about the impact on businesses a moment ago and throughout all my press conferences, and I know that COVID-19 is affecting all kinds of businesses in all kinds of ways, creating a lot of anxiety, just like there is at the personal level. We're working to help those businesses that are eligible to continue operating. One example, the Department of Codes and Regulations will extend the expiration date on all itinerant vendors, the technical term. We know them as food trucks. So food trucks, peddlers, and solicitors licenses and permits from March 31st to May 31st, 2020, those expiration dates are extended. Okay, don't worry about it. This will allow our food trucks and other vendors to continue operating as long as people are taking food away and not congregating. Regarding the alcohol and beverage control, we're aligning our policies with the state which has already extended the ABC license renewals to May the 31st. And our Department of Public Health and Wellness has suspended collections for swimming pool permits until those facilities open. We've also suspended late collections and subsequent closures for operating without a permit at food establishments. So again, food trucks can continue operating as long as customers are practicing social distancing. Okay, obviously these orders are crucial for all businesses still in operation. And while many businesses are complying, we're hearing about other businesses that are not and feel like they're putting short-term profits over people. Look, I'm a business person, spent the majority, decades of my career as a business person and entrepreneur. And I understand the pain this disruption causes on business owners. But a lost business can be restarted. A lost life cannot be. So please think about the big picture here. Those are the stakes that we're talking about right now. With this virus, we see it everywhere else, so we're asking you to work with us. So that's why our Metro 311 service is taking complaints about businesses that are not complying with the governor's order to close or to practice social distancing. Make these changes, and if you don't, you're going to be shut down. It's as simple as that. Okay, so please help us. So 311, you're seeing it on your screen right now, is a way to report anybody that's violating these orders. If citizens see businesses that are not complying with social distances, a lot of ways to contact us. You're seeing that on the screen right now. Okay? So thank everybody for their cooperation and thank the media for getting this out. I'd like to turn it over now to Dr. Moyer. As we've been hearing since the beginning, people over the age of 60 and those with chronic medical conditions are most at risk. Our Chief Health Strategist and Director of Public Health and Wellness for the community, Dr. Sarah Moyer, is here to talk about the interaction between COVID-19, people that are older, and chronic conditions. Dr. Moyer.
Thanks, Mayor. And thank you for taking those extra measures to protect the public. So good afternoon, everyone. For 3 weeks now, you've heard me mention that those with chronic conditions or compromised immune systems are at increased risk. And so today I want to talk a little bit more about that and what you can do to prepare. Because this includes far more of our family members and friends that we can imagine. It's estimated that 45% of Kentuckians over 18 are at serious risk of complications of COVID-19 due to the number of adults we have with underlying chronic medical conditions. That's 1.5 million adults in our state. So why are they such at risk? So underlying heart conditions can escalate the seriousness of any infection, including COVID-19. That's because someone who has a heart attack or has chronic high blood pressure can also have a weak heart muscle. So in the case of COVID-19 virus, the infection can affect both the heart and the lungs. The heart muscle might have to work harder because the lungs, which are primarily affected by the virus, may not be getting enough oxygen, and all this leads to extra stress on the heart, which then has a ripple effect on other organs, such as your kidneys, and even multi-organ failure. So this is one reason why you've heard such a need for ventilators. If the lungs are given the right enough oxygen, that helps protect the heart. People with diabetes are also at an increased risk of COVID-19 because over time, high blood pressure or high blood sugars damage the body's blood vessels. So with diabetes, high blood sugar is damaging a lot of different body systems, including the immune system. So if you have type 1 or type 2, it's really important that you work with your doctor to make sure it's under control. Uncontrolled diabetes puts you at risk for secondary infections, including COVID-19. COVID-19 also increases inflammation in people with diabetes and raises the risk of a life-threatening condition where the blood becomes too acidic. People with impaired or compromised lung conditions such as COPD and cystic fibrosis are also at increased risk because COVID-19 attacks the lungs. Those who have other reasons why their lungs might not be working 100%, like people who smoke or vape, are also at higher risk from the virus. Also want to mention asthma. The evidence is kind of inconclusive about whether people with asthma are at increased risk of COVID-19. However, the CDC suggests that the COVID-19 can affect the respiratory tract in those with asthma, and cause asthma attacks, which in turn can lead to worse outcomes. So just be aware that if you have asthma, COVID-19 could worsen it. So just make sure you have your asthma action plans ready and contact your provider if you don't have at least a 30-day supply of your asthma medicines at home. So for me, one of my sons has asthma, and so I called his physician and just made sure I had 3 months supply at my house right now in case he has more asthma exacerbations than normal over the next coming months. So those with weakened immune systems and people taking medications designed to dampen their immune system are also at increased risk of serious disease and death from COVID-19. This includes people undergoing treatment for cancer, people with HIV, people who've had organ transplants. Among cancer patients, it's shown that people with blood malignancies, such as non-Hodgkin's lymphoma, multiple myeloma, and acute lymphoblastic leukemia are at the highest risk of complications. But anybody under treatment for other cancers are also at elevated risk. And so while chemotherapy has the biggest immunosuppressive effects, radiation and surgery can also inhibit the body's disease-fighting ability. So that was a lot of information, and I know that knowing people that are high risk for severe disease from COVID-19 probably is causing a lot of stress during this crisis. So just some advice is just want to make sure you're talking to your physician over the phone, not in person, to make sure your chronic disease is well managed and that you have all the meds that you need for at least a month, if possible, a 3-month supply at home. And then 2, just recognize that fear and anxiety about COVID-19 pandemic can be overwhelming and cause strong emotions. This is normal, but in order to combat that, please take breaks from watching, reading, or listening to news stories. And social media, hearing about the pandemic repeatedly can be really upsetting. 2, make sure you're taking care of your body. Take deep breaths, stretch, meditate, eat healthy, well-balanced meals, exercise regularly, get plenty of sleep, try to avoid alcohol and drugs. 3, making sure you have time to unwind. Try to make sure you're doing things that you enjoy. Make sure that you're doing things that make you happy and laugh. 4, connect with others. Talk to people you trust about your concerns and how you're feeling. FaceTime on the phone are great ways to do this. And make sure to call your health care provider if stress gets in the way of your daily activities for several days in a row. And if you know someone you care about or are feeling overwhelmed yourself with emotions like sadness, depression, or anxiety, please call 911, call the crisis hotline, or reach out to a friend to talk to. So the bottom line for all of this, it's not just people who are at risk of serious disease and death from COVID-19. That's almost half our population here in Kentucky that has a chronic medical condition. So that might be you, and it's certainly somebody you know, and somebody in your family or one of your friends. And so that is why our advice to stay home, practice social distancing, and that's why we all come together to fight this by physically staying apart. So as we said yesterday, one person infected with COVID-19 can infect more than 400 people inside of a month if we don't practice social distancing. So the best, most powerful tool we have right now to stop the spread of COVID-19 is staying home. I know it's hard, but we can do it. And the more we do our part to comply with the state and city directives to stay at home, the less the COVID-19 virus will spread and the fewer people that will die. So please stay home, only go out to purchase necessities such as food or medicine, and please continue to be vigilant about washing your hands thoroughly. Remember, hand washing keeps germs away from your inside. If you wash your hands, you're not eating them, they're not going in your eyes, your nose, your mouth. I'm not touching right now, but please wash your hands. Working together, we're all going to get through this, but we need everyone. Our healthcare systems, including all the support staff that keep our hospitals clean and running, and our first responders and basic need providers need to continue to work. And so for everyone else, please, please stay home, practice social distancing, protect our loved ones who have chronic medical conditions or compromised immune systems. If we all do our part, this will be anticlimactic, but if we do this right, it'll feel like it was for nothing because we will have saved hundreds of thousands of lives just here in Kentucky, and that's what we're going for. So thank you.
Thank you, Dr. Moyer. Appreciate that. Okay, as we wind down the prepared remarks here, I want to close with examples of hope and compassion. We know that while we're asking everybody to be socially distanced, we still need to be socially connected. So I appreciate the Louisville Urban League hosting a community conference call every day at 2 p.m. and getting out the message that phone calls are the new hugs. And you gotta love this poster they put out there. So good job to our friends at the Louisville Urban League. Stay in touch on that call and feel the love. All right, nice job. And we all know that because of COVID-19, all of our restaurants have had to close their dining rooms. But the Louisville Takeout Group on Facebook, listen to this, has exploded with over 38,000 members, all looking to support local businesses by ordering out and buying gift cards. So I want to thank everybody who's made that effort such a success. And I encourage more people to join the Louisville Takeout Group on Facebook and support our local restaurants. Today is a great day to do that because today is the Great American Takeout Day, coming at a very opportune time. So get your takeout today, uh, get some home delivery. Let's commemorate the Great American Takeout Day by supporting our restaurants. And remember, tip big, bigger than you ever thought you could. If you got the capacity, throw it down and help our folks and friends that work in restaurants so we can help them survive through this health emergency and we can get back to their dining rooms and continue to enjoy these world-class restaurants that we've got here in Louisville with food and our hospitality professionals. We'll be there sooner or later. Okay, so again, the more we do the right things now, the sooner we'll reach that day. So everybody stay home, stay safe, stay informed, and we're in this together and we'll get through it together. All right, I'm going to flip over to the questions now. They're in our chat room, so reminding the media to please post your questions there. First question. Can the mayor please respond to President Trump's desire to start lifting some restrictions by Easter, which is on April the 12th, which is before the CDC's 8-week advisory? Well, uh, we'll be following the CDC guidelines, and the emergency order that I just extended there goes through May the 10th. So I understand everybody's desire to return to normalcy as soon as possible. But look, we've been through so much work and disruption already to prepare to defeat the surge. The last thing we need to be doing in Louisville or in this country is to say, okay, well, we just need to get back to regular life and then have all this go for naught and have massive loss of life. So we will be following the CDC guidelines when we make our decisions to resume life. For the small business owners out there and people whose lives are being disrupted by the virus economically, I'm understanding on my other screen here that it looks like an agreement has been reached in Washington, D.C. So for the big relief packages for this third supplemental, it's called. So we'll have more information later on in terms of what that means to you in terms of a direct check coming for some assistance, and then also the Small Business Administration assistance available to small businesses out there, which on the national level is defined as 500 employees or fewer. So let's all stay tuned for that later today. That should give us another deep breath here as we consider what the next steps will be. Okay, but let's be responsible from a health standpoint. Okay, question. Is there any worry with having enough firefighters to respond with a certain amount going into quarantine? As I mentioned, we'll be able to share tomorrow the number of firefighters that are going into quarantine. Uh, we're not concerned about that at this point in time. If it became widespread, much more widespread throughout the fire department, that would be a concern, but we're not anywhere near that point right now. Let's see, Darcy is asking, is Louisville Fire going to close the firehouse where the firefighter who tested positive works? And have any other firefighters been asked to self-quarantine based on their exposure to this person? Again, we'll announce more about that. I believe the firehouse is going through a deep clean, but if somebody else is on the call right now from the Metro side that can give more details about that, I would appreciate that. No other Metro response? Okay.
Bobby Cooper. Bobby, are you on the line?
Gene, how about if you just issue that out as information after our call?
Okay, will do.
Okay, a question come in. Want to confirm what time the parks, dog parks, and campgrounds were closing. They're closing at 5 p.m. 5 p.m. Okay. All right. All right. I think that's, I'm saying we are, okay. The question, I'm looking at my phone here for the answer. We're not closing the firehouse. We are consistently sanitizing facilities and apparatus. Fire department is being advised by the public health department on appropriate steps to ensure members and facilities are well protected. Okay, so that's the official answer to that. All right. I think with that, are there any other questions from the media? If not, thanks everybody for joining us today. Thanks for keeping us informed. We'll get through it together. So bless you, bless our city, bless our country. Everybody do their part. Thank you, guys.